Hello and welcome in. I'm Dan Edwards, and no, I'm not a doctor, nor do I play one of our Facebook Live chats, but it's great to have you with us tonight. I'm going to serve as your moderator this evening, and it's our Kettering Health Chats, the third one that I've been involved with, and it's great to be with you. Kind of like our Facebook fireside chats tonight. It really is live, it's interactive, you make this work, and you are what we are here for today. It's an interactive forum for you to ask questions of our doctor, our Kettering Health expert. And this is a topic today that I've been curious about. I'm going to learn right along with you today about this topic. So for the next 30 minutes, we're going to be talking about bariatric surgery and weight loss. And if you have any questions related to today's Facebook Live about bariatric surgery and weight loss, we urge you, please submit those questions in the chat box there. And we will get to those. Chris, our director, and Scott, and Kendrick as well from Kettering Health. I'm going to be relaying many of your questions and comments to me, and we'll relay those on to our Kettering Health experts. So don't delay, chat now. And it's like a free consultation. Who says doctors don't make house calls, right? Yeah. Well, today, again, an important topic, bariatric surgery and weight loss. And weight loss surgery may seem daunting and drastic at times, but it can be a very important step in your overall health. And Kettering Health has an experienced bariatric surgical team that offers you coordinated supportive care, and they really do an excellent job. Every step of the way, they're going to be there to help and support you in your weight loss journey. That's exactly what it is a journey. It has become, I think, a major health issue in America. So a variety of procedures, and we want to explain some of those services and procedures with our Kettering Health expert. Happy to say, Dr. Robert Polak. Doctor, thanks for being with us.
Thank you for having me.
Now, Dr. Polak specializes in bariatric and minimally invasive surgery, and he strives to help his patients live their best healthy life. He attended Texas Tech University, where he earned his bachelor's degree and medical degree and completed his surgical residency. And he then went on to complete a fellowship specializing in bariatric surgery at the Bariatric Medical Institute of Texas in San Antonio. And kind of a fun fact, Dr. Polak is a fish tank and aquarium enthusiast and enjoys traveling with his wife and playing golf. First off, welcome to our Kettering Health Chat, and welcome to the community. I understand you just kind of moved here recently.
Yep, I moved here in August and started in October.
How's it been so far?
So far, it's been great. The community has been really welcoming, and the people here are super nice, down to earth, hardworking people. Yeah. So it reminds me a lot of West Texas, but with trees.
Yeah, with trees. A little colder, I would imagine.
A little bit.
And you have a 1-year-old too.
Yes.
Correct? Fantastic. Well, again, thank you for being with us and sharing your specialty here with our Kettering Health Chats. And I understand you're also bilingual.
Yes. I grew up speaking Czech because my parents are from Prague, and learned English when I went to school. Oh, yeah. And my first words were hi, bye, and mine, and I was maybe 3 or 4 years old when I went to preschool, and then learned English from Sesame Street on TV. Mm-hmm.
Well, again, great to have you with us tonight. Regardless of the country of origin or wherever you're from, obesity seems to be something that we all struggle with at times. And as Americans, Doctor, you've been around. Are Americans some of the most obese human beings on this planet?
Well, it's getting up there, yes.
Exactly how much do we consider obese in this country? You have any facts or figures on that?
About 10 years ago, the obesity rate was about 30%, and that's sharply risen to 42%. Over the last 10 years, and it's only getting worse. So people are making poor choices, and with foods, convenience foods and things like that, it just makes overeating very, very easy. And all of a sudden, you don't realize it, and the weight packs on, and you become obese.
And the older you get, the tougher it is to get it off. Your metabolism goes down.
Absolutely.
Yeah, I've noticed that, boy. Pounds I used to be able to take, can't do it anymore. You really have to work at it. I'm lucky now just to maintain. So when you say, I guess, qualify obesity, where do we start? With BMI, I'm assuming?
Yes. It's a kind of just a standard number that we use based off your height and your weight. So everybody's on an equal playing field, and considered morbidly obese or obesity in general is a BMI greater than 25. Greater than 30 is considered obese, and then greater than 40 is morbidly obese.
Morbidly obese. That's when we're talking some severe health issues.
Yes.
So you think, though, it's just we're overweight in this country because of portion control? Is that kind of...
I think it's portion control. I think it's convenience foods. I think it's processed foods. I think there's a whole litany of things that help us gain weight. And we're not as active as we once were. We are just more sedentary, especially in our jobs.
Especially during COVID.
And during COVID.
Yeah, we're isolated inside, and that's all we're doing is having, Oreos all day.
Yep. So
well, it's personally speaking. I'm sorry.
Well, it's become extremely hard with keeping fit and getting the weight off. That's the hardest part for people.
Yeah. I think we have a graph here concerning portion control. If you can kind of walk us through that, just to give us a little more detail of what you're saying there.
So when you come visit with us, we go over this food pyramid. It's different from the one that you learned in school. It's a little bit upside down. The top is more important than the bottom. So what we say is live above the red line.
Live above the red line. Okay.
So the top row is protein. So protein is most important, just because as you lose weight, you want to lose fat, not muscle. So you want to keep those building blocks of muscle, because muscle is healthy, and it helps you increase your metabolism and keeps the building blocks of your body going, so you're not losing muscle mass. So protein is the most important, so that's at the top of our food pyramid. The other things that we focus on are fruits and vegetables, because they're high in vitamins, minerals, fibers, things that you need, but they're pretty low in calories, all things considered. Where we struggle is that purple row. That's the carbs, the breads, the pastas, the rice. Think of these as empty calories. They're filler foods. They don't do much for you. From a nutritional standpoint, they don't have many vitamins, minerals, things like that. So they make you full, they taste delicious, but they don't do much for you. So we want you to start avoiding those. It's not to say that you can't have them, because diets, as we all know, diets don't work. It's more of a lifestyle change.
Every single day, you have to stay active.
Yeah, you have to stay vigilant and mindful about what you're putting into your body.
Yeah. Should we consider obesity an addiction? Are we addicted to food?
Yes, and there is some good data to support that.
Interesting.
A lot of people choose food to deal with emotion, deal with stress. There's a million reasons why we eat the way that we do. Yeah. It could be out of boredom. It could be out of addiction itself. And if you're addicted to something like smoking, then you can transfer that addiction over to food if you're trying to quit smoking. So there's a lot of addictive type behaviors that go along with obesity.
And again, to bring up this time of during the pandemic, I mean, we've had so much. My problem is my office is 6 steps away from the pantry.
Absolutely.
Working at home, and I'm telling you, that's made a big difference. You really have to be careful not to do that, to train yourself, not to go in there whenever you feel like it.
So what we talk about is mindfulness.
Yeah, what should we do every day?
So every day you want to basically, what we say in the bariatric world, the bariatric lifestyle, there are things that you can control, because you can't control hormones and you can't control genetics. So those are two things that we wish we could control, but we have no control over that. So the things that you can control are what you eat, what you drink, and what you do for exercise. And making the best choices that you can throughout the day, knowing that you might have a slip up and a step back.
Right.
It's not the end of the world. We're human and we make mistakes, but being mindful about the things that we do and kind of understanding, knowing that, okay, I'm going to choose these things and they're going to be as healthy for me as possible.
I think we have a graph to pull that up if we could. And while we do that, just a reminder, please, if you have a question right now, Dr. Polak has shared something that has triggered something in your mind that you want to ask, don't hesitate to give us a chat right now, okay? We'd sure appreciate it, and we'll get that question passed along to our doctor. But as we pull up this graph, go into just a little more detail of what you're talking about here, what we should do every single day to stay on the path to health.
So we do want you to take vitamins and minerals just because they're healthy and they help with a lot of immune functions, a lot of processes that go on in the body. Drinking water. Water is your best friend.
Oh, yes.
So we want you to drink water. We want you to exercise. And then we want you to eat less concentrated sweets and fatty foods.
What do you suggest as far as exercise? I mean, get out and walk every day. 30 minutes, 45 minutes every day, right?
Our goal is 3 to 4 times a week, 30 to 45 minutes.
I'm saying every single day.
Yeah,
if you miss a day,
no, you'd be okay.
You still got that 3 or 4 in there. That's
Yeah.
I don't know. That's just what I do.
Yeah, typically we, if you can do 7 days a week, great. Yeah. But that's a lot for most people, especially starting from scratch.
Right.
So working, if you remember the story of the tortoise and the hare, I use this a lot. Be the tortoise and not the hare. Slow and steady wins the race here. Yeah. And start out with 1 day, maybe 15 minutes. Go for a walk. Go for a bike ride. Go for a swim, lift some weights. It doesn't matter what it is, but it has to be outside of your daily habit. Yeah. And slowly build it up to that 3 to 4 days a week.
I'm telling you, once you build that up, you miss it when you don't do it. I mean, that's what I feel. It's like I really hate it when I can't get out and do it because of your busy schedule or whatever, which people are nowadays. So, all right, so considering options for, I mean, obviously our topic tonight, bariatric surgery, you're the expert there. Seriously, we're dealing with life-threatening issue here.
Yes.
I mean, you're overweight, way overweight. Your body's working way too hard. So take us through this journey. Where do we start?
So you start with a consultation with one of us. That's in the office. We get a starting weight for you. From there, we talk about the bariatric lifestyle. We talk about what you eat, what you drink, and what you do for exercise. And we go into that into depth and detail. Then we talk about the surgeries themselves. If you are interested in surgery, we do offer some surgical options, and we can go into those in more detail at that time. The two that we offer are the gastric sleeve and the Roux-en-Y gastric bypass. There's 2 other ones that we don't offer because they just, one has too many malabsorptive issues and one doesn't lead to very good weight loss.
Okay.
So those are the surgical options. Then we talk about what does it take to get to surgery, and this is a process because you want to practice before you go to surgery. You want to practice the lifestyle, and that's the most important part. That's what's going to get you the success after surgery. It's more so the lifestyle.
So you're beginning those habits before you even go under.
Absolutely. We want you to practice those before we even go under the knife because of the fact that if you change nothing, you will lose weight, but you'll gain it back.
Yeah. Real quick, doctor, we had Valerie just send us a chat, and she says, can people with diabetes have this type of surgery?
Absolutely. It's one of the main reasons for diabetics to get bariatric surgery. It has an extremely good remission rate for diabetes. Not type 1, but type 2 diabetes, which is weight related.
And then Jen also, ladies, thank you for sharing your thoughts with us here tonight. Do you have patients work for 6 months to learn better habits before surgery? Is that the habitual part of it that you were talking about? Is that what she's referring to?
Yes, it's kind of the process, but it's not necessarily 6 months. That depends on your insurance. And every insurance plan is a little bit different. And we have insurance specialists that go into their plan specifically that will tell them how many of these supervised dietary visits they need prior to being acceptable for surgery. Right. So sometimes it's up to 6 months.
But overall, insurance companies see the importance of this.
They are turning
proactive.
They are definitely turning around. There's a lot of push towards bariatric surgery now, and especially in the last 5 years, a lot of insurance companies would not approve it or would not pay for it, and it's been shown time and time again that with weight loss, you decrease a lot of these comorbid conditions like high blood pressure, diabetes, heart disease, stroke risks. They go down and you become much healthier. So it's actually cheaper to do the surgery in the long run for the insurance company.
Absolutely.
But they don't see that. It's a bottom line thing.
Well, we won't talk about that in
Yeah.
our time with you here, so we'll move on. But Elise also had another chat question here for us. And is it true that lemons help your body?
Well, it has a lot of vitamin C, yes.
Okay.
So, and
Do you
a
get
lot
lemon in your water when you go out to?
Yeah,
out to dine?
it tastes great.
Okay.
It
fair
also
enough.
it also
Fair
makes
enough.
water less boring.
So you are dealing with patients who qualify as, I hate this word, but it's what it is technically, morbidly obese. So again, we talked about what qualifies as morbidly obese at 40% threshold or 35%
With comorbidities.
with comorbidities. And then when someone seeks medical help for weight loss, I mean, do you need to have somebody come in with you? Is it good to have an advocate with you to be that support person? Or
It's great to have a support system.
Okay.
If you want to try it to do it alone, that's fine too. But there's a lot of online support groups, and having a team with you to lead you through this journey, it leads to better results.
Okay. You know, you mentioned there are a couple of different, you mentioned 4 different procedures that you can have. The sleeve and the bypass is what you prefer.
Yes,
As a doctor, the expert.
Those are the 2 that we offer in our program.
And tell us a little bit of the difference of sleeve and bypass
Okay.
and the success rates thereof.
Okay, sleeve is basically taking a football-shaped stomach and turning it into a banana-shaped stomach. You basically take about 80% of the stomach out and create a small, narrow cylindrical tube that will help you eat less. And by that because of that, you'll lose weight. The nice thing about that is it also affects a lot of hormones that are related to your.
I thought we couldn't control that.
Well, you can it helps with surgery, but the body will find a new set point about a year to year and a half out.
Interesting. And then the
that's the
sleeve is you say about 80%?
80% of your stomach, yes,
and then,
is taken out.
And then the bypass.
The bypass, what we do, we don't remove anything, but we divide and create a small pouch of stomach, and we bring up a loop of intestine and make a new connection. So it's basically cut, divide, and reroute. And we're rerouting the intestines, which again affects your hormones, and that's why it's so good for diabetes and high blood pressure, things like that.
The fact that we want that sense of I'm full. That's why we're reducing the stomach so
Yes.
far. Which one of these does a better job at that?
Both.
Both do. Okay. But you can still continue to gain weight on this, is my understanding.
Absolutely. And that's why, in my opinion, lifestyle is actually more important than the surgery itself.
Interesting.
Surgery is a tool, just like anything else. If we sharpen that tool, it's going to work for us. If we leave it on the shelf in the garage, it's not going to do much for you. And it's making the right dietary choices, healthy lifestyle, and controlling what you eat in moderation. That's what's going to lead you to success.
Hey, Sherry just sent us in a chat. Thank you, Sherry, for doing so. And her question, Doctor, how well does the body retain vitamins after one of these procedures?
So with both procedures, the chances of vitamin deficiencies are there. We do have a specific higher dose vitamins that we have you take after surgery to help minimize that. If you are taking your vitamins, the majority of people will stay in a healthy range and will do just fine. It's really when you don't take the vitamins that you're going to get vitamin deficiencies.
Well, this is wonderful information. It gives you hope, but more importantly, it's like to get you on that track before you even have the surgery. How difficult is that for people to wrap their brain around that they're coming up as a huge life change for you?
It's a process, and that's why we have this whole 2 to 6 month process of doing the dietary visits, visiting with a psychologist to make sure from a mental standpoint you're ready for this big change
That's
in your
huge.
life.
Yeah.
Visiting with a dietitian to go over foods in more depth and detail. And because we believe in exercise, we have an exercise physiologist that will also work with you and talk with you about what you've done in the past for exercise, what you're doing now, and come up with a plan moving forward.
What is the average age of someone who goes through the surgery?
You know, there's no real average age, but I think a lot of people come to it in their 40s and 50s, especially when they realize that, you know, my health is getting worse.
All right.
So it's just one of those things. We have a very wide range of patients, early 20s to 60s and 70s.
This may not be in your wheelhouse here, but do insurance companies give you a discount on life insurance, or when they see the investment you're putting into your life and trying to change your lifestyle and to be a better human being? And
You know, I have no idea.
no idea. Okay,
I would hope they would.
Like I said, not your expertise.
No.
But you do get a team of people. That's what I find interesting. So when I walk in, my first appointment is with you.
Yes.
You do the consultation. Will you be with me through that journey?
Yes, but we also have some nurse practitioners, physician's assistants,
Okay.
along with the medical staff, trained nurses, medical assistants, people who deal with insurance, who are our insurance experts, along with the dietitian, the psychologist, the exercise physiologist. It's a whole multi-centered team working with you and getting you the best success that you could possibly have.
And once you have that success, there is the excess skin.
There is a potential of excess skin, yes.
Potential of how do we navigate that, because that can be a huge optic for people.
We usually wait until people either reach their goal weight or are out about a year and a half to 2 years, because that's when your body kind of resets itself and says, this is the weight I want to be, and anything else is going to be hard work on your part. So the hormones will kind of settle themselves out. Right. You'll have lost the weight that you want, hopefully, and if that is an issue, then we do have options with our plastic surgeon colleagues.
Man, you folks are asking some excellent questions here tonight. Thank you for your participation. And Stina wants to know, how often do people need a revision?
So revision is not uncommon, but it's also rare. That's one of those things where if they develop a problem that they might need a revision, if they're not losing weight, they could potentially need a revision. And
qualify the revision. What is that?
Going back and doing another surgery.
Okay.
Whether it's changing it from the sleeve to the bypass, or sleeve to the duodenal switch, or redoing a connection if that connection's become bad. Redoing these things and revising them and helping them.
So you don't see it that often?
No, we don't do it very often, no.
So do you think it's a good idea? I mean, obviously the benefit of having this surgery, you're going to be healthier. You're going to look better. I think you'll feel better and all that. But do you think a person should talk to their family first about this? Because this is a pretty huge step.
It is a big step. But it's really when it's the right time for you.
Yeah.
And think of it this way. You know, you take a smoker, and everybody tells them, "Oh, you need to quit smoking." It's this that smoker is not going to quit until they're ready. You see what I'm saying? It's the same thing. It's the same thing with obesity.
Sure. So maybe we can I know we've got a slide here, preparing for weight loss surgery. So maybe we should just kind of set it up a little bit. Maybe we've got someone interested now who thinks that they may want to have this surgery done. Completely safe. You've done many of them. And so kind of prepare us for the surgery.
Okay. So you see us, you go through your dietary visits, which is basically the supervised diet. And what we're going to be talking about is eating regular meals, and again, using our food pyramid that we talked about earlier. Eat protein with each meal and every snack. Eat slower and take smaller bites, because you'll get that sense of fullness faster. If the faster you eat, the more you're going to eat. Be more mindful when eating, and that's where we talked about mindfulness and understanding what you're putting into your body, as opposed to just going out and buying some fast food, you know. And then exercise and strength training.
So that's a good way. That's a good blueprint to kind of get things started. And normally, when someone calls Kettering Health, you can usually get scheduled fairly soon, I would imagine.
Yes.
Yeah.
Especially now that there's two of us taking new patients. We can our backlog with the pandemic is much better.
Much better. You still have protocol though that you have to follow because of the CDC, obviously, which is just wearing masks. I mean, come in and. I think we should wear masks from now on inside hospitals, period, from this point forward. But that's another soapbox for me to get on. Doctor, we're kind of running out of fire and running out of time here.
Okay.
Do you have anything else that you would like to share with us as far as, I guess, psychologically? I mean, that's got to be a concern for you to find the right pick. Do you choose them? Is there a board that chooses them, or if they want to, if they want the procedure done, you will fulfill their wishes?
Well, it's a team effort.
Yeah.
So it's coming to a consensus with the patient about if they do decide to do surgery, then which surgery would be right for them. Getting them to the surgery and then getting them the support that they need around the time of surgery and after surgery. And we don't ever push surgery on anybody because we do have a medical weight loss site as well that we can use medicines and things like that to help with with appetite suppressants, portion control, and help increase the metabolism as well from a medicine side to help them lose weight.
Excellent.
So it's not that we're forcing surgery. Surgery is a tool just like anything else. I feel that the lifestyle is the most important.
Okay. Well, you've certainly given us a lot to think about here tonight. I know a lot more than I did before we started, so thank you for that great information. I guess if we have that proper expertise, I mean, it's a good decision. It can change people's lives. And I guess my final question to you, doctor, is you're the one changing these lives. What's it feel like for you to have someone come in, successfully gets the procedure, no revisions needed, they have a great lifestyle now, more active, and just a happier person? How does it make you feel?
Well, it's very rewarding. And that's the reason I got into this. We go through a lot of schooling to go through medical school, residency, just to operate on somebody. It takes 9 to 10 years to be able to go through that. And when I was choosing a specialty, I wanted to choose something that was going to actually have a major impact on somebody. And I love when people do really well.
Yeah. You've seen a few, huh?
Absolutely.
That's great. That's great. Who is your partner down there, may I ask?
Dr. Carrie Brown.
Okay, fantastic. Well, this has been wonderful. A great Kettering Health live chat, fireside here. It's been great to have you with us tonight. Now, we want you to join us next month for another Kettering Health chat. I don't know if we'll be beside a fireplace, but we'll certainly be here. We're going to be focusing on a topic that has probably impacted each and every one of you at one time or another in your lives. We're talking about heart failure. And we're going to learn more about the symptoms and causes of heart failure, as well as the treatment options that will help you live a healthier life. So look for those updates on this Facebook page. All right. We should have brought some marshmallows. We're ready for some marshmallows here, Doctor. That's not on the pyramid, though, is it?
No, it's definitely not. Well, it's beneath the red line. But it's okay to have them every now and then.
Oh, that's great. Well, thanks again, Doctor. Pleasure to meet you.
Thank you very much.
Welcome to the community.
Appreciate it. Thank you.
Look forward to seeing you down at Kettering Health. I'm Dan Edwards. Thank you so much for joining us here at Kettering Health Chats Live. Great conversation. On behalf of all of us here, we hope you have a safe, healthy, and warm winter's evening, and we'll see you the next time on Kettering Health Chats Live. Kettering Health, be your best.